Hello, everyone, and thank you for joining us today. My name is Carla Alegria with the National Center on Domestic Violence, Trauma, and Mental Health. Today's webinar is From Power Over to Power With, Applying a Trauma-Informed Approach to Our Work. Our trainers today will be Elizabeth Eastlund, Executive Director of Rainbow Services, and Eleanor Lyon, a Senior Research and Evaluation Consultant with the National Center on Domestic Violence, Trauma, and Mental Health. Before we get started, I would like to go over some technical details of the WebEx software that we'll be using for today's webinar. Many of these details are explained on the Using this Webinar System tab on the upper left-hand side of your screen. Please be aware that your screen might look a little different depending on whether you're using a Mac or a PC. On the right-hand side of the screen, there are multiple boxes. The second from the top is the chat feature. This feature will allow you to provide feedback and share resources with your colleagues, as well as get contact with the trainers or myself if you have questions regarding the training content. You may contact Angelica Medina, also at the center, if you have questions troubleshooting the WebEx software. To do this, click the down-facing arrow and select the person you would like to contact. You will see a lot of options, but for this session, you will want to select all participants if you would like to respond to a question from the trainer or to contact me anytime during the session. You should click on Angelica Medina to privately contact her if you are in need of troubleshooting the WebEx software. So let's test this chat feature. Will everyone please go to the chat box, click on all participants, type in where you're calling from, and then press enter. Perfect. Thank you all very much. While folks can get a lot out of the chat feature, there are times when it moves really quickly and can feel distracting. If this is true for you, you can feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you choose. We will be providing live captioning during this webinar. Below the chat box, there is a media viewer box. This will contain the captions. If you do not want to see the captions, click on the down-facing arrow next to the word Media Viewer, the same way you might if you want to hide the chat box. I will be moderating the Q&A at the end, time permitting, and at the very end of the webinar, you will be taken to a brief evaluation. Please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received in the original WebEx webinar link and re-enter the training. Sometimes the sound cuts out due to internet connection, so feel free to call in if this is a problem for you. If you're experiencing technical difficulties and are unable to contact Angelica Medina, you may call WebEx tech support to resolve any issues. The phone number, which we will post in the chat box, is 1-866-229-3239. Again, thank you for joining us today. I will now turn the training over to Eleanor.
Okay. And I'm not seeing the slides, I'm sorry. Can somebody put up the slides? There we go. Yay. I'm really excited to be here today and to be talking about this partnership with Rainbow Services in Los Angeles. Just want to give you a quick overview of what we're going to cover. We're going to do some of the basic introductory stuff, and then Elizabeth will talk about some of the basics and the history of trauma-informed care and approaches and what Rainbow has done as part of the process of transforming to a trauma-informed culture. then I'll come back on and give you some evaluation results, but I promise this is not going to be dense with numbers, so everyone can feel calm, although numbers are available. They are not going to be presented today. And then Elizabeth will talk about some of the implications she sees for moving forward with this effort at Rainbow, and then we'll talk a little bit about resources and opportunities for learning. And we should have plenty of time at the end for questions, which you can put in the chat. So, Elizabeth, please talk about
Hi, everyone. I too am really excited to be able to present on Rainbow's experience in transforming to a trauma-informed journey or a trauma-informed organization in our work with Eleanor. It's been a pretty amazing past couple of years. And just to let you know a little bit about Rainbow Services, we've been around for 35 years, and we specifically serve survivors of domestic violence. And we do that through a variety of support services, shelter, housing programs, including emergency shelter, transitional housing, and the newer models, rapid rehousing and domestic violence housing first. We have an array of support services, and we're really fortunate to be connected with the center and doing more work to understand trauma-informed care and really placing survivors at the center of our work. Thanks.
Okay. So just want to tell you a little bit about the National Center. You probably are fairly familiar with it, but it's been around since 2005. It's one of 4 special issue resource centers. It's been funded by the Family Violence Prevention Services Administration, which is part of the Family and Youth Services Bureau and Health and Human Services. And its focus is on the intersection of domestic violence, trauma, and mental health. The slides have changed since I last saw them. So the center really focuses on creating and supporting responses to domestic violence and other trauma, including ways to measure those things, to measure trauma-informed organizations, practice, and outcomes, and also provides training and TA on all of those issues. As Rainbow has been working to become more trauma-informed, they approached us when they got a specific grant, and so as part of our work at the center in developing tools, it's been a real pleasure to work with them on this evaluation. And now we would like to see if we can find who is actually attending. You should see in the chat box a place to record your vote, whatever best represents you, and so that should be on the right of your screen, or at least it is online. So please let us know. By clicking the little circle to the left of the advocates, managers, supervisors, administrators, funders, or public sector departments or programs. This will be really helpful for us as we want to tailor what we're saying to people who are here. So the poll has now ended, and does someone see results?
I'm waiting to hear from Angelica about the results. I wasn't able to see them either.
Okay.
It gives an extra 5 seconds for some reason. Okay, here we are. So we have a lot of advocates on the call, which is amazing. All right. And then the next thing we wanted to ask about was people's experience in receiving information around trauma-informed care, whether this is the first time you're hearing about it, if you've been applying some approaches, if your organization has had some training among different staff groups that, around trauma-informed care, if there's been training on specific trauma-informed approaches across different staff groups, or are there ongoing efforts to implement a trauma-informed culture? And again, this is for us to understand who we're speaking to so we don't get too detailed if a lot of you have had some of this information already. So the poll will stay open for another 30 seconds or so.
Okay.
All right. Well, that's amazing. Almost half of the attendees have some ongoing efforts to implement a trauma-informed culture. Many have had some training on trauma-informed approaches amongst staff groups. Very few have had none. So we will be reviewing just the basics of trauma-informed care before going into the evaluation results.
Do you hear me?
Yeah, I can. So if you could pass
great.
the control to me, then I can get through the next few slides.
Okay. I just wanted to point out that our funding sources have no responsibility for what we are about to share with you. So they are the views and experiences of us at the center and of Elizabeth at Rainbow.
Yes, and I did want to say a special thank you to the Blue Shield of California Foundation, who provided funding for us to go through a formal evaluation with the center, and among other things in terms of developing our trauma-informed approaches over these past few years. So, just talk a little bit about what is trauma. And these are not the slides that were updated. So this is just one version or one definition of trauma by Judith Herman. I think on the other handout that is available to you, there are several definitions of trauma. And Judith Herman talks about how people are often rendered helpless when they experience trauma, and when that force is one of nature, we speak of disasters. When that force is of other human beings, we speak of atrocities. Traumatic events overwhelm the ordinary systems of care. They give people a sense of control, connection, and meaning. And we talk a lot about connection at Rainbow. We know that trauma causes disconnection, and so our whole approach looks to rebuild connection with people and help people rebuild connection with themselves, their families, the community. One of our hashtags is healthy connections build healthy communities. So trauma and approaching trauma is really about connecting people. The shift from a more traditional system of care to trauma-informed culture is really a pivot by asking what's wrong with you to asking what happened to you, from a power over approach to a power with approach. And those of you who have worked in social services for a long time may know that our approach has not always been the kindest. We I often describe the old model of power over being that I am the expert, you're the damaged person coming to us for help, and we tell you what to do, and you have to take these 12 steps and you'll be healed, versus power with understanding that as someone who works in this field, I have information that may be helpful to you, but you are the person that is the expert in your own life, and so I'm going to share power and share my knowledge with you in hopes that you feel empowered to make decisions that are best for you and your family, regardless of what my views on those decisions may be. So also taking judgment out of the relationship. And then trauma-informed services assume that people are doing the best that they can at any given time to cope with the life-altering effects of trauma. And again, victimization can lead to disconnection with self and definitely isolation from others. So our whole challenge is to create authentic reconnection during the healing process. And I often say that this is also true for providers, and I think trauma-informed care does has a good model for how we take care of ourselves and our staff, because as providers, we're also doing the best that we can with the very limited resources we often have. Some of you may be familiar with this. The next few slides are both from the National Center on Trauma-Informed Care and SAMHSA.gov. The trauma-informed approach realizes the widespread impact of trauma and understands that there are many potential paths for recovery. It recognizes the signs and symptoms of trauma in clients, families, staff, and others involved with the system. So as I said, when we understand trauma a little bit more, we understand everyone's reaction to trauma and how certain situations may be triggering, not just for participants, but also for our staff and others involved in our system. So really understanding how widespread trauma is helps us to support staff in a much deeper way. And the system responds fully by integrating knowledge about trauma into our policies, procedures, and practices. So the more we know, the more we can tell how our policies and practices may not be as trauma-informed as we would like to see them. And finally, the approach really seeks to actively resist re-traumatization. So how can we move to a system that is that's foundation is strengths-based and where we start from a place of kindness? And in order to do that, we have to recognize the symptoms of trauma within our own lives and how we are approaching our work. The guiding principles of trauma-informed care include safety. I think for those of us in the domestic violence field, this is kind of a no-brainer. This is our foundation and where we work from. Trustworthy and transparency. The model really understands that we need to build trustworthiness with the people that we are serving. It is a shift away from tell me your whole story right when I first meet you to what is the least amount of information I need to know in order to serve you so that we can start building a relationship and building trust. And then I think there's a lot more transparency in the model in terms of explaining to people why we have certain practices or procedures versus just saying, well, this is how we do it, that we spend more time explaining some of our practices so that people understand where we're coming from in our efforts to be of service to them. I think peer support and mutual self-help has been a part of the DV movement probably since the beginning of time and is really where our movement started. Collaboration and mutuality. I think the collaboration definitely goes back to the power with, that we are collaborating in this journey together with the people that we are serving. Empowerment, voice, and choice. How are we truly helping participants feel empowered to make their own choices? One of my favorite quotes by Brene Brown, which is also in the handout, is that connection is the energy that is created between people when they feel seen, heard, and valued. And so how do we create a model of care, a system of care in which people feel seen, heard, and valued? not just our participants, but also our staff. How are we empowering our staff to make choices that support the work that they do, and how are they feeling seen, heard, and valued in the work that they do? And then finally, the cultural, historical, and gender issues take into account that people are not just walking through our door with one experience of intimate partner violence, that there is a lot of cultural factors or maybe historical factors and definitely gender issues that need to be considered in our development of this model and how we apply trauma-informed care in our daily practice. Okay, and this is so weird to kind of do a webinar and I have the same interaction. This is my very first time doing this, so bear with me. Here in California, I just wanted to share a little bit of why Rainbow decided to make the change, and part of it was influenced by policy changes that took place over the course of time. I've been with Rainbow since 2006, so shortly after I was hired, we were required to attend trainings by our state funder that focused on improving access to different groups of people, people who were using substances, who had mental health issues, persons with disabilities, the LGBTQ community, because what they were finding was many shelters were screening people out. They were asking, when was the last time you used drugs or alcohol? Someone said, oh, a week ago, and they would find a reason not to serve them. So in 2007, it was really about improving access to people who were challenged not only with the trauma of being abused by their intimate partner, but also may have been from a community or dealing with other issues. So how can we change our policies to make sure that we are not screening people out? So I think for Rainbow, that was kind of the beginning of the discussion. Why are we screening out survivors who use substances when we know that that is a coping mechanism for a lot of people? And we should, rather than screening people out who have mental health issues, we should assume that on some level survivors are coming to us that may have symptoms of mental health issues. And how can we make our policies more inclusive so that people who identify as lesbian, gay, bisexual, or transgender feel comfortable in our shelters? So that was part of it. And then in 2015, the same thing, the state of California, our state funder said that we have to move to a participatory, or, I'm sorry, let's see. That we couldn't require people to engage in services as a condition of their shelter stay. So additional training was provided at that time. We had already moved to a voluntary participation in services probably a couple of years prior to that. And some other states may be familiar with this one because I believe it originated with the Family Violence Prevention Services Administration. So I'm not sure if this is happening across the country. Hopefully it is. But basically, we don't want to require that people engage in our services just because they are staying in our shelter. The hope is that we are making our services, that they are engaging enough for people to want to be a part of them. And honestly, that was a huge change for us when we did that. But one that has gone fairly well. So in terms of what does a trauma-informed organization look like, we really hope to be survivor-centered, and what that means is that we are taking into account, we're putting survivors at the center of our work, and we're looking at, can we be more flexible and adaptable to the needs of the family? Can we start by asking, what is it you need, versus by saying, these are the services we have to offer, which box do you fit in? Can we build hope and decrease shame and empower survivors to see their options and to see solutions rather than facing major challenges? So I think for us it has really created a more flexible approach to the people that we're serving. So Rainbow really began this journey many years ago, I would say 2007, before we even had the formal language of what trauma-informed care is. But it really begins with how we communicate with the participants, with their children, and with one another. We want to set a collaborative tone in everything that we do, and we really want to come from a place of strengths and respect. And are we using language that is strengths-based and respectful when we're speaking not just to participants or to staff, but about participants? We want to cultivate an environment of hopefulness for sure. And then finally, part of this whole journey was to engage with the National Center to do a formal program evaluation and to also help us understand what are the factors that we want to continue looking at to make sure that we're on the right path in providing survivor-centered services in a trauma-informed way. So our commitment to continuing this trauma-informed culture, I've spoken about the strengths-based approach. We implemented that several years ago, in which when we had everyone in our organization do the Strengths Finder, and then we looked at not just our individual strengths, but collective strengths of different staff groups, and then across the board in our organization. So I think that we wanted to do that to show people that we can come from a place of strengths rather than a place of challenge and deficit, which is often how nonprofits are led. So we want to kind of shift the way we think to coming from a strengths-based place. Rainbow is very much committed to learning new approaches, to learning on an individual basis, to developing staff and their professional skills. We do regular staff training, and through this process, we have created a leadership development program for our coordinators and managers to help them shift from kind of an operational approach to supervision to a reflective approach to supervision, and understanding that trauma-informed care really kind of looks at the world a little bit differently than our traditional systems of care. We implemented individual and group supervision, especially with our shelter staff. One of the things we really learned in this journey was that our shelter staff were sometimes the least supported people in our organization in terms of individual supervision, in terms of group supervision. Our case managers and counselors and paralegals all had, all do have individual weekly supervision. They have group supervision, they have regular training. So we wanted to make sure that our residential staff and shelter staff had the same amount of support in the work that they were doing and the work that they do. So we created a reflective practice group that we hold monthly, and that has been really helpful to contemplate together some of the challenges that we face in supporting survivors and their families, and also developing plans that include how is the work affecting us, and how are we taking care of ourselves and one another. So we do we try to do some wellness events with our staff, where we take an hour or two to just have fun together, and we have a cheerness committee that organizes staff events. Most recently, we had a quarterly birthday bash, in which we celebrate our staff's birthdays. So that is always fun. And then we did create organizational values several years ago, and for a while we were doing organizational value awards in which staff could nominate one of their coworkers who was exemplifying one of our organizational values. And then finally, we're really committed to regular evaluation, and that is when we got in contact with Eleanor, was to engage in that evaluation. And then I'll just say a few things about shelter rules and rethinking shelter rules. It was a long journey to get to where we're at today, and I think we still have a ways to go. But moving from rules to guidelines, we went through many different revisions over the year, and we really wanted the input from our shelter staff And one of the main questions we asked was, does this role have anything to do with safety? And this was the real transformation, I think, in how we approach things, is, you know, asking if this does not have anything to do with safety, if this situation in which we're challenged with right now doesn't have anything to do with safety, then might we take a little bit more time in contemplating how we want to approach resolving it. Because as you know, working in a crisis shelter, working for an organization in which people are coming to you in crisis, we often ourselves feel like every decision is super critical. So by being able to ask, does this have anything to do with safety, we're actually allowing ourselves more time to operate from a more reflective place versus a reactive place. We asked, what are the risks we're taking if we let go of a role? And what may be the benefit of letting go of these roles? You know, being able to offer people support in a way that takes into consideration their unique needs as a family or an individual is super important. So rather than requiring services, we want to be mindful of our language and saying, you know, we have these services. What do you think would work best for you and your family? And are there other services that the person is requesting that we can consider offering versus just saying, no, we don't do that? And then if there's kind of a regular ask from different people, we really look at evaluating, is this a type of service that we feel we have the expertise and can offer, or is it something that we need to partner with another organization in the community to offer? One of the other things that we've learned in doing this work is that by saying you can't, it does not leave space to discuss options for being safer. So if we say you can't use your cell phone, you can't have any contact with your abuser, you can't work, you can't do this or that, you can't stay out overnight, you know, those things were already happening. So we shifted our language to say, you know, if there's a time where you feel like you are going to have a conversation with your abuser or with the person who harmed you, let's discuss how you might be able to do that safely. If you feel like it's safe for you to keep your cell phone and to use your cell phone, let's discuss how you can do that safely, and then showing them options in their phone for different levels of protection. Because you know, I think that it's unrealistic to think that people are not going to have contact with their abuser or with other people in their life that they're close to who they may need to reach out to for help. And I don't know about you, but if I didn't have my cell phone, I would not have anybody's contact number. So rather than continuing to say you can't, we really shifted to look at how can we make policies and talk about safety in a different way. So in the chat, if anybody wants to share ways in which you're already applying the principles of trauma-informed care in your work, this would be a great time to do it as we transition back to Eleanor, who will be sharing specifics about the evaluation we just went through. But we thought that if any of you are willing, please share how you're already applying some of the principles of trauma-informed care in your work. And then now I'm going to turn it back over to Eleanor to talk about the evaluation.
Great. Thank you, Elizabeth. And you can tell that this has been a journey that Rainbow had been on for some time. And that made the evaluation a little bit more challenging because, you know, you're trying to measure change as part of an evaluation, but a lot of the change had already begun by the time we at the National Center got involved. We tried to employ some principles of trauma-informed evaluation, And so we began by meeting and talking with Elizabeth and other staff, and then with a site visit to become much more familiar with staff and their concerns and their existing experiences. And we were able to incorporate some of that information and some of that wonderful sharing that the staff did in a fairly intense day into the actual measures that we used. So the main features of the evaluation were what you might call pre-surveys and post-surveys, and then looking at the change between the two. The only challenge here was that the pre wasn't entirely pre. It was just at the point at which extra funding for a more intensive effort had been obtained. So there were 3 different surveys that we used for this. Some of that, well, actually all of them had already been developed in one way or another through our work at the center. So they had been developed and tested in conjunction with training curricula, as well as more intensive work with other sites on aspects of trauma-informed changes. So the first one is sort of looking at the organizational level. And Elizabeth talked a little bit about what it means to be a trauma-informed culture. And so this is at the organizational level. I mean, it asked questions about policies, about the training, about capacity, and staff confidence in the ability of Rainbow to address a wide array of issues. And it also asked about training that staff had received and training that they wanted more of. So that was part of our feeding information back very quickly to Rainbow to help with organizing and identifying specific training that staff were interested in. So that's at the organizational level. At the second level, we looked at practice, and this was the practice by staff members who have any kind of direct contact with survivors, participants. So looking at staff knowledge, how they approached their work with survivors, and the support that they received in that effort. And for that we use something that we now call the Accessible, Culturally Responsive, Trauma-Informed Practice Measure, ACRTI. So that was the second level of survey. And then really the whole point of becoming more trauma-informed in part has to do with the impact of staff and culture, but also really importantly, improved outcomes for participants who are survivors. So we asked them questions about the support that they had received and about the changes that they had experienced as a result of those services, and that's with our Trauma-Informed Outcomes Scale. It's important to note that this scale was developed over a period of 3 to 4 years of effort. We did 9 focus groups with 59 survivors in 6 different domestic violence programs across 4 different states. 3 of those focus groups were in Spanish, 5 in English, and 1 in Korean. And from there, we used their language and their sense of the changes that they most wanted to experience as part of developing the Trauma-Informed Outcomes Scale. Before we worked with Rainbow, we had tested it with 14 programs in 2 states, and 2 of those programs were culturally specific Latina programs. And something else that's important to know about the trauma-informed outcomes scale is that it also incorporates the trauma-informed items from the trauma-informed practice scale that was developed by Chris Sullivan and Lisa Goodman. So we incorporated that so we could get feedback from survivors about how their interactions with staff had gone, as well as changes then that they had experienced. And also as a part of way of understanding their experience, we asked them what was their involvement in services. So we administered these 3 surveys at 2 points in time, one very early on in the process and one just very much more recently. We just completed that process in January, and then we're able to go back to Rainbow, meet with staff again, share the results from the surveys, and get their feedback about what they thought that all meant, and some additional input from staff. So that was the design, and the surveys were administered about 1.5 years apart. So for looking at organizational change, we at each point administered the first survey that I just talked about to all staff. But when we analyzed the results, we compared, we looked at, for the second point in time, only the staff who had been there throughout the process. So, you know, as in any organization, there is turnover, and so we did not want to include people who had been on the Rainbow staff for only a couple of weeks. They would have different perspectives because we wanted to get a sense of the change over time. So these are some of the ways in which we were able to measure through those surveys the impact on the organization of this effort to become much more trauma-informed. Found that commitments to trauma-informed practice, to listening to survivors, to treating survivors in unbiased, non-discriminatory ways were really incorporated into the culture, both in practice and increasingly in written policies. Staff reported at a higher rate at the second point that staff opinions and concerns are valued and respected. Certainly a critical feature of a trauma-informed culture. There was also a regular review of policies that were responsive to the trauma needs of survivors. So more staff reported that this was an ongoing and critical feature of Rainbow and Rainbow's trauma-informed culture. Shelter guidelines, as Elizabeth was talking about earlier, have been definitely reduced. More had been become guidelines. There was more evidence of flexibility within the shelter that staff reported, and Elizabeth mentioned cell phones. That was one example when we said, what has Rainbow done to be responsive to survivors? That was an example that was provided. And as I mentioned earlier, confidence in Rainbow's ability to address the needs of participants, of survivors, increased from the first survey to the second survey. So 6 out of 9 of those specific areas that we asked about, staff reported that they were more confident at the end of this time than they had been at the beginning. And so that was in mental health, relating to the survivors' mental health issues or concerns, substance use, trauma about in the context of going to court, immigration-related issues, and domestic violence, sexual assault, and other related other lifetime trauma, and cultural and/or historical trauma, including political trauma. So the ones that were really most strongly showing an increase in confidence were the mental health, experience of domestic violence, sexual assault, and other lifetime trauma, and the ongoing effects of cultural, political, and/or historical trauma. So another area of the organizational survey looked at staff support, and these were areas that responses were on a sliding scale from very true to not at all true. And so these were some of the major areas of staff support reported by the staff in the survey, that they got regular supportive supervision. So this increased over this period of time, that careful attention was paid to workload, the staff wellness, and we didn't know about the cheerness programs, but staff wellness programs and mental health and substance use treatment benefits were all reported at greater rates at the second point in time. We asked an open-ended question that was related to this, and one of the things that, or among the things that staff reported, is that there was much more flexibility throughout the organization in approaches to survivors, that they were holding more conversations at different stages of the services provided with survivors, and that there had been new areas developed that responded to the needs of families who have pets, and new areas within the shelter for men. So those all occurred during this period of time. So we also looked at practice-related changes, and I said that there were different areas. So the first area were changes in knowledge. So there was a lot of training that went on as a part of this effort, and we asked on the survey about 14 different areas of knowledge, and every single one of them improved. These again are self-ratings of knowledge, and it's important to measure these, but I always have a little bit of reservation about it, because one of the things that we have found sometimes is that people at the beginning say, gee, I know a lot about this particular topic, and then after they've received training on it, they realize how much they didn't know and how much there was to learn, and so sometimes people rate themselves as less knowledgeable once they have more information than they were at the start. But that didn't occur here. So you can see the areas on the slide about, they showed increased knowledge about the impact of DV, different types of trauma, different ways to provide support for survivors, how to be understanding and support survivors when they're experiencing particular stress or difficulty, that folks responded that they knew more about how to be trauma-informed in practice, which might seem like it's, what in the world does that mean? There's been a lot of training about the importance of being trauma-informed, but when it comes down to actually being in a situation where you're working with a survivor or you're interacting with colleagues in your organization, that folks actually knew more about how to talk or how to respond or how to understand the situation differently in the very specifics of practice. Impact of self on interactions, basically what that means is having a better understanding of how who I am and what my experiences are can have an impact on the way that I interact with survivors and how survivors might see me, and also how to talk with survivors about difficult issues. One of the things that we found was that the changes in knowledge especially increased for the clinical and counseling staff. So both the range of different kinds of knowledge, and since it was a self-rating, you could say that you really didn't know too much about it, to all the way up to feeling like you were an expert, that they moved more in the direction to feeling really strong in their knowledge grounding. Okay. Having trouble advancing the slide. Okay, so we asked the staff who work with survivors about changes in practice with regard to participants at all levels. So one category of what they did was about everybody that they interacted with, adults, youth, and children, and then some that were particular questions about the way that they engaged in practice with adults, and a few other questions addressed for those who work with children, their approaches to that work with children. So the major areas of change that we saw there had to do with empathy, and these again are my summary words. They're not the specific words because I wanted to be able to convey a lot of information more quickly. So empathy was much more likely to be, was put as, I try to put myself in their shoes. Providing information about trauma or reactions had to do with more normalizing people's experience. Remembering that difficult behavior may be trauma-related had to do with being less judgmental. Participants determining pace and plan. So participants determine what they will work on, what will be said, how the work together will move forward. Staff reported an increased level of sharing strategies to cope with trauma, so dealing with trauma reminders, or what we have called triggers, and situations that are particularly stressful. Much more likely to talk about children as part of working with adults. Staff became more likely to explore spiritual and religious supports for healing. Much more likely to engage in self-reflection, so their own reactions to participants, survivors. And again, increased confidence in response to mental health, substance use, and trauma. Qualitative responses in this area talked about some of the services that they had added, so that they had more specific support groups as part of the shift to becoming more trauma-informed. So they had support groups that were focused on parenting. They had added beyond trauma and seeking safety as particular group approaches to working with survivors. And okay, so here we get to the changes that we found in participants, that were reported by participants. So these are the items that come from the trauma-informed practice scale that I mentioned was developed by Chris Sullivan and Lisa Goodman, that we incorporated here. So participants at the second point in time reported higher levels of support on 6 out of the 8 practices that we talked about. As examples, staff respect the choices I make, and staff have talked with me about how to handle unexpected reminders of the abuse and difficulties I've encountered. Another example was I have had opportunities to learn about how abuse and other difficulties can affect one's ability to think clearly and remember things. So those kinds of things participants reported at a higher level. And it's important to note that at the point in time at which survivors, participants completed this survey was after they had received at least a week of service, but it wasn't necessarily at the end. So if we had been able to do a more controlled study that was able to identify a real ending point, which we know is always challenging, we might have seen more dramatic changes. The other area was that we also found that participants reported more support on all the practices that were related to parenting. So here's an example that you see there on the slide. But every single item reported more support in that area. Here we come to the responses to the trauma-informed outcome scale. This is the area for adults, and we found that there was more change reported after Rainbow had gone through this process on 18 out of 24 items. Again, these are summaries of the items and not the exact wording of the items themselves. But again, all of these areas came from survivors in the focus groups that we conducted before we ever developed the scale. So these are just tremendous areas of individual level changes. I won't read them to you, but if you have any questions about those items, I'd be happy to try to answer them at the end. I think the other thing that I really want to point out here is that these are the adult, talking about myself, changes as a result of services. And when we looked at the relationship between these individual level changes reported by survivors and the degree of trauma-informed staff support that they had received, there was more change when there had been more trauma-informed staff support and practice reported by survivors. So I think that's really important, that these increases, these changes are associated with trauma-informed practice. We also, of course, looked at changes for participants related to their children. And again, we did not ask children questions as part of this, so these came from adults. These were the main items for survivors reporting about their parenting, that they're able to talk about the effects of abuse with their children. They are more likely to see the children as themselves and not as their abusive partner, which sometimes survivors have reported having difficulty with. My child reminds me so much, these particular traits of my abusive partner, that sometimes that gets in my way. So this was a change that they reported. They have felt like they have a better response when their children do things that they don't like, that earlier they might have engaged in more yelling and screaming. and now respond in a different way, and that they feel an improvement in the relationship, that there are not taboo topics, there are not as many secrets or areas of challenge in conversation as there might have been before, and that they also report seeing a change in their children. Their children are more likely to turn to them for help, have used what they've learned from Rainbow, and feel better about themselves. So I'm almost to the end of results. We asked open-ended questions of the staff about the challenges that they had experienced in trying to become more trauma-informed at Rainbow. And these are the areas, the ones that have quotation marks are. The other ones are, the first two are my summaries of more complex kinds of challenges that many staff had reported. So this was definitely a process. It was not something that necessarily was just completely easy and automatic to implement. And they also reported on successes, and all of these are direct quotes. They're exactly the kinds of changes you would hope to see as a result of becoming more trauma-informed. Changes in participants were particularly the ones that they felt that they emphasized. They also reported feeling more supported by supervisors, and so more support in the work that they do. So those are really positive signs of progress and of impact for the participants and survivors and staff at Rainbow. Clearly there's still some work to do, but we felt very encouraged by these results. And so I will pass this back to Elizabeth.
Great, thank you, Eleanor. Every time I hear this stuff, it just warms my heart to know how far we have come in doing this, because I think for some of you who are in the midst of doing this work, it is very challenging on the day-to-day level to try and change a culture of an organization, and at the same time very necessary, I think, if we are putting survivors at the center of our work. So I'm just always happy to see how far we have come. And in terms of where we're going for the future, one of the things that continues to come up that I made a note of is around accountability. I often get asked about that. How do we balance the trauma-informed approach with holding people accountable for their behavior? So that is something that we're committed to in terms of exploring through regular staff training and supporting people's professional development. We are in the midst of examining staff roles now and the need for specific training amongst the different groups of staff, so that there are some staff training where we have all together, and then there's specific training for, say, counselors or shelter staff, depending on the needs. We're hoping to develop an alumni group to have better a group to reach out to for input into our program services. We had a participant advisory group a long time ago. We need to get back to making sure that we have opportunities for people who want to continue to stay connected with the organization even when they no longer need the actual service. So being able to provide that opportunity for survivors is important. And we want to continue to be engaged in learning communities, and we are part of, in California, we're part of a group that is looking specifically at survivor-centered approaches So I can send out a report that was done just this past year that's called Against the Grain, that came out of bringing together a number of organizations that had been funded by Blue Shield to really look at survivor-centered approaches. And what does that mean? Because just like saying trauma-informed care, people will say, well, of course we're trauma-informed, but are we really? So being able to continue to learn from other organizations in our network is really important to us, and being a part of those communities allows us to share our story, which is what we're doing today and what we hope to continue to do in terms of writing up this experience and sharing some of the tools that have been developed out of our work with Eleanor and the center. And so these, and I'm sorry, for some reason we have our old slides on here, but these are just some questions to contemplate as you think about what you've learned today. And I think definitely looking at what support you might need to address any barriers that you're facing in your efforts to transform to a trauma-informed culture. I think for us at Rainbow, we're very fortunate to have the support of the executive team to really make this change. And so that is so necessary to have the support from the top down to make this change. These are some of the resources where we've learned a lot from. And there was a handout that was shared with, I think, all of the participants that's just like a 2-pager, and it has a lot more resources on there for learning. So, and then these are the center's resources, including for the self-assessment. Let's see. I think that is like the end of our formal participation or formal presentation, and then we'll go into questions. Carla, did you have specific questions that have come through? And if people want to start asking questions in the chat, we'll have Carla kind of take a look at those. We may not be able to get to all of them, but we will try to answer a few in the time we have left.
In the chat, and one of them was, what barriers did you encounter when making the shift?
Okay, so we face several barriers. I think first is just people's, the lack of people's ability to change or embrace change was probably the biggest barrier. All of us, you know, kind of have a different relationship to change. I mean, I'm someone who feels that change is one of the only constants in our experience. So I'm very comfortable with change, and I'm also comfortable with uncertainty and not knowing what the end goal is, right, or what the end of this process is going to bring to us. Though there are a lot of people who were very uncomfortable with the changes that we were making. I think that whole shift in power, from power over to power with, was very confusing for some people. The shift away from rules to guidelines meant that you had to have a much deeper conversation with the people that we're here to serve. And so I think for some staff, they felt like their power was taken away and they didn't feel empowered to make decisions. So we're really still dealing with that in terms of how do we ensure that staff feel seen, heard, and valued just as our participants do, and that we're sharing power with the people we're here to be of service to. I think along the way, I mean, this has been going on for a number of years. One of the hardest things to do is to have to, you know, let go of people who are just not going to get this model. And so I think that we've made some changes even in our hiring practices that help us understand people's relationship to change and their willingness to learn and their own ability to be self-aware in some of the practices that they have.
Okay, earlier on there was another one. What, if any, thoughts on DV programs asking potential volunteers if whether or not they have had experience in domestic violence or sexual assault, or worse, what is their experience?
So for our volunteers, we have a director of volunteers in education who meets individually with potential volunteers before they sign up for the training. I'm not sure that we ask that specifically. It tends to come out at somewhere along the way. I think even in our employment interviews, when we ask about why domestic violence or what connects you to this field, that often people disclose at that time. So we don't ask directly, but it's often revealed in those interviews. So really looking at their intention for wanting to do this work and also their ability to do this work in a way that they have some awareness on how they may be affected or triggered. And I think this whole model of trauma-informed care has helped us better understand our own relationship to trauma and our own ability to heal and to cope with really stressful and difficult situations. So if they may come into this work or to volunteering without that level of self-awareness, but hopefully through supervision and these ongoing training opportunities, people have more ability to reflect on how the work is affecting them. Eleanor, do you have anything you might add to that about asking specifically about people's experiences?
To be honest, I was looking at the questions in the chat, and so I think that's a good summary. We will be preparing a full report of the evaluation and some of the different kinds of things that staff reported, and it'll be up to you, Elizabeth, whether you want to make that available, but all of these, the findings and the way in which changes were reported by staff will be included in all the number-based loving detail that I neglected to share this time.
Okay.
All right. There are a ton of questions. I'm reading through them now. Let's see. We're looking at, do you use certain model or have suggestions for us as we begin to do this? Oftentimes information passed is factual but negative at the same time.
I'm sorry, could you repeat that? You were kind of breaking up there.
Do you have a certain model or have suggestions for them as they begin to use this?
Mm-hmm. So I think for us, we started with just how do we apply the principles of trauma-informed care and the approaches that were developed by the National Center on Trauma-Informed Care in everything that we do. So really reviewing those principles and understanding how they can be applied to each and every situation is a good start. I think the National Center on DV Trauma and Mental Health has a good self-assessment tool that will help you kind of look at where you're at now and where you can go. For us, we did a lot of different things in the beginning because we didn't really have any guidance, so we took it from a lot of different places, including just looking at what is the training that staff needs, not just around trauma, but how do we communicate with one another. So things like motivational interviewing, using the principles of harm reduction. I think harm reduction was something that I brought into the organization when I first started that fits very nicely with this trauma-informed approach. So we kind of piecemealed it in the beginning because there wasn't as much guidance as there is now out there for how do you do this. And then part of what this whole experience is teaching us is trying to provide some sort of toolkit for the field. So that's really the intention of this work and our collaboration with Eleanor and the center is to get to a point where we are sharing tools for the field, especially around evaluation.
And the National Center does have in process and near completion and some completed, as Elizabeth mentioned, tools for measurement, tools for the process of becoming more trauma-informed, a lot of curricula and tips. So those are also available or within a month or two of available.
All right, another question, have your efforts or research impacted policy funding opportunities in your region?
Well, it's a huge job, you know, to try and affect policies. I think in the city of Los Angeles, one of the ways we were able to affect policies, the domestic violence shelter operations is finally looking at evaluating our programs from a place where we're looking at the different factors such as safety and community involvement and reducing isolation, things that are more relevant to domestic violence programs than to what we've traditionally been screened for or evaluated on. So yeah, I think our efforts have changed some of the performance outcomes for various funding that we have here, including when we've been really active in our Los Angeles's continuum of care process. And so one of the things that we really tried to influence was the performance measures for the HUD-funded transitional housing programs and helping our local COC lead understand that not everyone's going to increase their income when they're in a domestic violence transitional housing program. Unfortunately, in Los Angeles, we still have a few programs left that are funded by HUD, but we're also working to make sure that even if the county or the city funds our programs, that there are certain things that survivors need more time to accomplish, including increasing their income. So one of the performance measures we changed or got to change was to have them look at maintaining income as a success for a survivor in a transitional housing program. I mean, you know, a lot of the people we serve are on welfare, and they're not necessarily going to change their income in 9 to 12 months. And while it would be ideal for them to do so, we understand that the experience of our families means that that may not happen. So maintaining income can be seen as a success for some families, and not losing their income, a huge success. So really trying to help policymakers understand how success for survivors may be different than for other groups. I hope that's helpful.
I mean, and just to say from the evaluation, one of the things that some staff mentioned as part of the change was different and newer community linkages. And one example being a more recurring linkage with the Mexican consulate and other bodies that host cultural events, and so that has really expanded survivors' ability to participate in meaningful activities that might be in the community and not part of Rainbow's direct services.
All right. Sorry as the train passes. Did you engage your board members to make sure that they understood the importance of trauma-informed practice?
Yes, so prior to becoming executive director, I was a director of programs for 9.5 years, and I would regularly let or present to our board of directors on what trauma-informed care means and our efforts to transform to a trauma-informed culture. And now, as executive director, I have a little more influence on the information that is shared with the board. So as much as possible, we try and provide them with information about our efforts and the recognition that we're getting for really being a leader in the field and implementing this model.
Okay. Could you talk more about the hiring practices? What have you done and found successful?
Again, I think that one of the things we ask in our interviewing process is what are the values you bring to this work, to try and see if they're similar to either our organizational values or if they mention one of the principles of trauma-informed care as one of their values, commitment to social justice. I mean, all of these things are really important, and I think that the answer to some of those questions is really important, especially about, what are your strengths, and then also where do you see you need to develop your skills. So people who are able to answer where they need more professional development have some awareness that they don't know it all, right? Because none of us do. So I think we just really look for people who have some openness to learning and to changing and to supporting survivors in a way. And I think that just even recognizing people's language when they talk about the work, when they talk about the people that they serve, is a huge indicator as to whether they would be a good fit for our organization and our culture. I think we've always tried to consider how would this person fit in with like our other staff, and then how, beyond how would they work well with the participants, it's how do they fit into our organizational culture. And we do that by asking about their own values and their own need to continue learning.
How did you talk to clients about finding the time to take the tip scale feedback form? Most clients are in a hurry with the demands of life. Did the survey sheltered clients mainly?
About half of the respondents, half of the survivors who responded to the survey were in shelter or in transitional housing. But Rainbow also has a counseling program, and so others were involved in counseling. Others were receiving a variety of different kinds of services. We were able to offer a $10 appreciation award, which may have helped, and I think the involvement of staff in presenting the reason for the survey and the kinds of questions up front also helped survivors to see how important it was to be able to provide that feedback, and that what they said was going to be important and taken seriously. So I think all of those things.
Okay. Let's see. Okay, I'm just going to read out this whole question comment. We're a young emergency shelter, and we have no transitional facility in which our residents can move to after exiting our program. Staff were discussing this morning the pros versus cons of staff determining an exit move out date for residents when residents aren't able to do so. What is the best trauma-informed care approach to use with the residents in this scenario?
That's a real big one. I mean, I think that there has been there can be some miscommunication around what trauma-informed means and having exit dates, right? And I think one of the things, and I don't know that this relates to the question at all, but it just reminds me, one of the things that we found in transforming to a trauma-informed culture was that we're asking people to leave. We were asking less people to leave our shelter, and we really only ask people to leave our shelter if they've been violent towards others, including staff, or threatening. So, but if it's just their time to move out, I mean, it's a hard conversation to have, but hopefully one that starts, you know, from the very beginning, just providing reminders that this is a temporary situation and looking at the options in the community to move people onto. And, you know, I know many communities are challenged with not having affordable housing, and for us, what we've seen is an actual increase in our average length of stay. Years ago, our average length of stay was 21 days. Now it's 42 days. So on one hand, we're, you know, acknowledging that people may need to stay longer. On the other hand, we're serving less people as we allow people to stay longer. And I think we're always kind of grappling with that balance, like how do we move people on more quickly? Because, you know, a communal shelter is not the ideal situation for someone who has been traumatized. And I think the whole goal is to get them to a place where they are stable and supported in staying stable and safe, right? So sometimes with our residents in emergency shelter, there are very few options for them to go to a place that is safe and that will be stable ongoing. A lot of people will go back to living with family and friends in their own community. Some go on to transitional housing. We have a lot of opportunity right now to partner with our homeless services organizations to look at what other options for permanent housing may be available to people. Though with an emergency shelter stay, there's very little time to try and help people figure out where they're going beyond their stay with us. So that's an excellent question and one that we continue to grapple with. So I don't think that, you know, again, I think it goes back to the accountability piece, and we can apply trauma-informed care principles to our work, and at the same time that people eventually have to leave. We're not you know, we say we're a 90-day shelter. Some people stay longer, some people stay less. But like I said, our average length of stay is about 42 days.
I think that might be, how did you convince counselors and other mental health experts and others that they need to be educated on trauma-informed care?
So when I first started learning more and more about trauma-informed care, we had a lot of different trainings around trauma, around motivational interviewing and harm reduction and different things, and we established more of an ongoing regular staff training approach, though convincing people took a while, right? I mean, there's articles written on the organizational change process. It was not easy, and it was quite painful at times, because what I found was I was super ready to move forward, and I understood the need for this change. And what I learned was I needed to also engage staff and get their buy-in in order for the change to be successful. And I had to understand that people have different reactions to culture change, and that it's best to have lots of conversations about the change prior to actually making it. And I think the other thing I learned is you have to honor the past and where we've been before you can move forward to this type of culture change. So honoring that the practices, the rules that were set up in shelter were done so out of concern for people's safety. And that's fine, though it appeared like a rule was made for every time something went wrong. So acknowledging why things were the way they were and honoring the work of the people who came before us was essential in making our change and looking at people's attitudes towards change, and then providing support in different ways, whether it was through individual supervision, as groups, and really being transparent about how some decisions are made in terms of applying this approach. And I think we're still getting better at that.
All right. I think with that, we have run out of time.
Yes.
So I would like to thank you, Elizabeth and Eleanor, for a really great webinar today, and thank you to Caption Colorado for providing today's captioning, and thank you to Angelica for making the webinar run smoothly. Last but not least, thank you all for spending your time with the center. Within a week, I'll be sending a follow-up email with a link to the recording and today's webinar, in addition to the slides and handouts referenced, all of which will be available on our website. You will also receive a certificate of attendance for your time today. At the end of the webinar, you will be taken to a very brief evaluation. If you could please take a moment and let us know what was useful and what could have been better, it would be greatly appreciated. Thanks again, and we hope you have a great afternoon.
Thank you.
Thank you. Bye. Bye.